Exactly 4 o'clock. So we will go ahead and get started. Good afternoon and welcome back to our fourth and final session of our Vax Fax open office hours. We have really enjoyed the opportunity to share the latest and greatest tools and resources available for increasing vaccinations for COVID-19, pneumococcal, and of course, influenza. Next slide, please. Today, we'll be having a very interactive session with two of our pharmacists, Stevie Sai and Kyla, who will be demonstrating effective and ineffective vaccine competence, followed by an open discussion with our very own Alana Jarman, Senior Manager and Coalition Lead, along with Dr. Kunzweiler, our Chief Medical Officer, who works very collaboratively with our Mountain Pacific staff to support our colleagues and healthcare professionals in implementing transformational change and promoting high quality healthcare. Before checking in on how we did during our last session, I would like to mention that Mountain Pacific is supporting the month-long vaccination effort recently launched by the Department of Health and Human Services We Can Do This campaign to ensure 70% of adults receive at least one COVID-19 vaccine shot by July 4th. We're very excited to see this and various other events taking place nationally to help increase vaccines and increase equity and distribution. We have included additional information at the end of today's presentation so that you're able to access these great resources. Next slide, please. Now I'm going to pass it over to my colleague Stevie to do a quick Menti Pull on our activities from the last time.
Thank you, Caitlin. If we can pause the share, I will pull up that Minty Poll.
And it has also been dropped in your chat box. If you want to take a look in chat, you can click right on that link, and then we will also share it through our PowerPoint as well.
All right, so for the Minty Poll, please go to either click the link in chat or go to menti.com and use code 59674081. And we are curious to know whether or not you reviewed the risk versus benefit materials from last time and had a conversation with two colleagues. And we're starting to see those results come in. Looks like we've had 5 responses. So we'll give this about 20 to 30 more seconds for anybody having trouble getting in. All right, and we will go ahead and move to our next question now. You can still join the Minty Poll, and we are looking to see now, yes or no, did you conduct a risk versus benefit conversation with either 2 patients or 2 peers? Thank you, everybody, for your feedback. This is very helpful. And we will keep rolling. So next is our discussion around how to increase employee vaccinations. And I'm going to pass this over to our interviewer and our panelist, Dr. Kunzweiler. Please keep in mind this is an interactive conversation. And so we would like to encourage you to participate. You can either, oh, excuse me, I'm ahead of myself. We're going to have a model conversation here to talk about what it might look like when you have vaccine hesitant peers. So Kyla and I are going to have a little mock conversation here.
Thanks, Stevie. So first, we're going to demonstrate a poor example of how to approach vaccine hesitancy with a healthcare professional colleague. And then we're going to do a superb example. So I'll have you guys weigh in after we get done to see what you think may have been a better approach and what tactics were used. So, hey, Stevie, how come you haven't gotten your COVID vaccine yet?
Oh, you know, I just, I'm really not sure about it. It felt really rushed, and I just, it just doesn't seem like it's for me right now.
You know, it's been tested in thousands of people, right? I just don't think you're making the right choice. What about all the patients you're in contact with every day?
Well, I mean, like, I care about them, obviously, but like, I have to do what is right for me.
Okay, well, there are some pretty sick people we work with, and a lot of them are older, so they might be at pretty high risk. Have you thought about that?
Yeah, I mean, but like, I talked to a nurse from the hospital the other day who received the vaccine, and she still got COVID. And so, like, if I'm already going to get it anyway, I can still get those people sick. I just don't see the benefit.
Well, I don't know. Maybe you didn't get the full story because the vaccine is 95% effective. It does take about 2 weeks after your second dose to get that full immunity, though. So maybe that's what happened to that individual.
Maybe. I've also heard there are a bunch of people who've missed work because of all the side effects. I can't afford that. I need my paycheck. Plus, I heard some people got blood clots or heart problems after the shot, and that's crazy.
Yeah, but that stuff's really rare. It just gets over publicized in the media. And they haven't even linked any heart issues to it yet anyway. So I just think it's the right thing to do.
Well, I'm still just not convinced.
Well, I just think you need to consider others in your decision. That's all I'm saying.
You have your opinion and I have mine.
Hey, Stevie, how come you haven't, have you decided to get your COVID vaccine yet?
I just don't trust it. It seems like it was approved so quickly. I really want to wait and see how it goes.
Well, if it builds your confidence at all, you know it's been tested in thousands of people. And, you know, not that many bad things have happened so far.
Yeah, I guess
Actually, millions now that I think about it.
Like, nothing horrible has happened, but I did hear some reports of blood clots and heart problems. You know, people are having to miss work because of side effects. All of those things make me very nervous.
Oh, most of the side effects are mild. And plus, that's a good sign your immune system's working. The severe side effects are super rare.
I guess you're right. I don't know.
Well, I'll let you know one of the main reasons I got the vaccine is because I want to protect the patients we work with every day, because we do have a lot of older patients and patients that are sick, have chronic diseases.
Sure, but it's not like I work in the hospital with lots of sick people.
Yeah, still, our patients are an older population. So have you considered that in your decision?
I guess I hadn't thought of it a whole lot. No.
Another reason I got my vaccine is so that life could get back to normal. And I feel like I owe it to my patients and to my community to get myself protected and also to protect them.
I'll think about it. I'm just not quite sure yet. I don't like shots in general. I'm just not sure yet.
Well, hey, I'll tell you what, when you're ready, I will personally administer your vaccine for you.
Okay. I will think about it and I will let you know.
All
Thanks.
right. Thank you. So I'm curious if you want to put in the chat some of the differences you notice between conversation 1 and conversation 2.
Yeah.
Oh, I guess we have a Menti for it.
We do.
Cool.
Say we're both in, either in the chat or in Minty. We want to know what went well. And here in a minute, we will ask you what could have gone better for both conversations. So in that same Minty link will work to plug you back in so that you can continue interacting with us. So what went well? Being respectful of the patient's concerns. I agree. There was a different tone between conversation 1 and 2. Acknowledging the other person's feelings is important. Listening. Say that's part of that active listening, and it's a motivational interviewing technique to acknowledge how a person is feeling and incorporate that. Taking time to thoroughly discuss, yes, to really hear their concerns and address them directly. The first conversation was accusatory. Yes. Unfortunately, in this pandemic, we are starting to get tired, and sometimes it's frustrating when we're dealing with people who aren't ready to get the vaccine. We have to be careful about the tone and the way we speak to them. That is great feedback. I'm going to move us forward and would like to know what could have gone better. Additional information. Yep. Have more actual facts to present regarding that benefit versus risk. Yep, like what we talked about 2 weeks ago. More information on the statistics. Yep, it says healthcare professionals, a lot of times we like the hard science. Meeting more at where they are at. Yes, really hearing them and understanding what their concerns are and then walking them through. Providing that sound data to support. Yes, giving those cold facts. Know what matters to them first. Yes. Like having that knowledge of either our colleagues or our patients, of knowing what is most important to them, and then having that be part of our conversation is really important. Especially helps with it not having to assume. And then don't downplay fear of side effects. Yeah. Part of these vaccines, because they work so well, we do expect side effects for a good chunk of people, about half of them. And so acknowledging that that's a real thing and helping them anticipate and deal with it is important. Not giving the person a guilt trip. Yes, you have to, because it's the right thing for our patients is a lot. Yeah. More information, less personal preference. Being attentive to the person's thoughts and feelings. Yes. Wonderful. That is great feedback. I'm going to move us forward. And now I'm going to pass it over to my colleague to interview Dr. Kunzweiler. And again, this is where I was saying we'd really like this to be an interactive discussion. Feel free to come off mute and ask Dr. Kunzweiler your questions, volunteer your ideas, or you can type all those things in chat.
All right, I think I'm up. Is it my turn now?
It is your turn,
Yes,
Alana.
okay.
Thank you.
I just want to make sure. All right. Well, thanks for letting me be a part of today's Vax Fax. So of course we have some interview questions or some kind of discussion questions that I'm going to go through with Dr. Kunzweiler. So Dr. K, I think I already had COVID, so I don't really need the vaccine.
Yeah, and that's a common thing that you will hear. And, you know, there are, as we talked about, there are good ways to approach this and bad ways. And trying to shame people into it or embarrass them is obviously not a good thing. So when somebody tells you I already had COVID, so I don't need it, I think, you know, your response should be along the lines of, well, I understand that makes sense, but there are some things that when I really looked into it, I hadn't really thought of at first. But it turns out that it has been studied pretty thoroughly at this point, and people who had the disease and were positive and recovered don't seem to mount as strong an antibody response as the people who were vaccinated. So it's recommended that even if you had the illness and recovered from it, that you still get the vaccine. And another aspect of it is that we aren't completely sure that if you have recovered from it, that you couldn't still harbor the virus and be transmitting it. And so for that reason, also it's recommended that you get the vaccine to stop transmission and to make sure that you're as protected as you can be. So I would stress those things.
Right, thank you. Yes, I actually, true story, I actually had COVID and I've been fully vaccinated. And when I think of like the my why and just kind of giving testimony, I did get a little bit tired and things like that, but
Yeah.
definitely understand the importance of
Another thing I forgot to mention is that people who have persistent symptoms, and I've seen a number of people who have had persistent loss of smell and taste and fatigue and that sort of thing. It turns out that if you get the vaccine after that, people seem to be recovering more quickly from that than if they don't get the vaccine. So it can also help you in that regard.
Yeah, I can definitely testify with the lack of smell. And where I live, I have to drive by a water treatment plant. And I don't know if any of you are familiar with that smell, but it's not a good smell. And that was, to me, I was like, well, that's the silver lining. I don't have to smell that anymore when I drive by it. But after I got the vaccine, I actually am starting to smell better.
Yeah.
Well, I smell better, but I mean, I'm actually smelling things better.
Right. My son-in-law lost all sense of taste and smell, and he started to lose weight. And he actually got kind of depressed. And you know, we think, well, that's sort of a trivial symptom, but it's really not at all. It's very significant when you can't smell and taste. He said, I may as well be eating newspaper. It doesn't make any difference to me. So that's kind of a horrible thing to go through. So that's another a good reason to get the vaccine, is to prevent that.
Exactly. So another thing I've heard that a lot of people will say is that there are a lot of side effects with getting the COVID vaccine.
Well, it certainly is true that there are side effects, and you don't want to lie to people and tell them that there aren't side effects. And most people don't like getting vaccines. They don't like needles. They don't like the soreness that goes on. But I think you can tell them truthfully that the side effects of this vaccine are really pretty mild. There's almost everybody has some arm soreness, that lasts for a short period of time, 24 hours, 36 hours. Some people have some headache, some fatigue, they might have some nausea, but these are all very short-lived and they are pretty mild side effects. Most people don't even miss any work because of this. On the other hand, if you get COVID, you just don't know. You might be asymptomatic, but you also might be one of the people who get very sick and wind up in the hospital and struggling for their life. So when you compare minor, fairly short-lived, very short-lived side effects versus the potential that could happen when you get COVID, it clearly it weighs in favor of getting the vaccine and putting up with some mild discomfort for a day or so.
Yeah, I actually, an article that Kyla had shared with us, vaccine hesitancy among rural hospitals, the arrival of a challenging, quote, new normal. I read in there that there was a fact that there is approximately 1 intensive care bed for every 10,000 people in rural America. And I think about that when COVID first started and the devastation that healthcare providers were having to triage and decide which patients got a ventilator and which didn't. So essentially meaning they had to decide which patients had to die, which was very heartbreaking.
Right. We were somewhat lucky in the states that we serve, and that our population is small enough, we never got quite into that situation. But some of the larger population centers had just a horrible time. And it was horrible for the families, it was horrible for the patients, and it was horrible for the caregivers.
Yeah, it was. So another question I've heard is, can COVID cause heart problems like endocarditis?
And the vaccine cause.
The vaccine, yes, sorry.
As we know for sure that the COVID virus itself can cause an inflammation or an infection of the heart, myocarditis. It kind of likes the heart. And there were some reports, they didn't come out right away because it seems to be mostly younger people. When they started vaccinating the younger age group, 12 to 18, there were some scattered, isolated reports of patients getting an inflammation of the heart. And it's still being looked at because viruses can all cause myocarditis or inflammation of the heart. Old viruses can do that. Some viruses are more prone to it than others. COVID is particularly prone to it. So when you vaccinate a bunch of people and then some of them get a condition, you have to try and decide, is it because of the vaccine, or is this just what we would normally expect to see in any population, that we were examining? And it turns out that probably the heart inflammation they're seeing in kids who were vaccinated is about the same as the number of kids you would see who were not vaccinated. So it's still being looked at carefully, but it's not at all clear that it's related to the virus. It may just be the sort of background that we see, 1 in a million kids, if you look at them over 6 months, are going to get myocarditis from a cold virus or some other virus. And 1 in a million kids that you vaccinate are going to have the same thing happen. So it may be real, but it's a very rare side effect, if it even is real at all.
Yep. And I know that the issue with COVID with children is the, what's the syndrome where just systemic inflammation.
Right, systemic inflammation. Yeah, that's kind of the same sort of thing. It's very rare, but it seemed like the younger kids, like preschoolers, early school age kids who were getting COVID, a small number of them were getting this inflammatory syndrome. And other viruses and other infections can do that as well. It's rare, but COVID definitely is able to cause that in little kids.
Yep. So another question, going back to Stevie and Kyla's, their conversation back and forth, how do you handle trust and mistrust issues of the vaccine? How would you handle that?
Yeah, so I think the first important thing is to question people and try and find out where they're at and what their hesitancy consists of. And you do that in a respectful manner, not in an accusatory or embarrassing manner, but you just ask them, I understand that you have some concerns about the vaccine. Can you tell me more about that? Much in the way you would get any other medical history, from a patient. So you just ask them respectfully, how do you feel about it? What is it that is holding you back? What are your concerns? And then you have to really listen to what it is that they're saying. Are they afraid that it's developed too quickly? Are they afraid that they will have some bad side effect from it? If it turns out that they are just dead set against it, either for political reasons or for religious reasons, or maybe they're just dead set against vaccines, you'll get the sense of that pretty quickly. And there's really not much point in pursuing that. But if what you're hearing is that people have real concerns about the safety or the effectiveness or side effects, you need to really listen to that. You need to validate their concerns. And a good way to do that is to say, when it first came out, I had some of these same questions, but I looked into it, and then you can recount where you got your information from, from people who do this stuff for a living. And then you were reassured by the statistics, you were reassured by the data, you were reassured by the testing that was done. Some people feel like, well, this was released too soon, they didn't really properly test it. And it turns out that's not really true. They tested it on about the same number of patients that other vaccines that have been recently developed were tested on. They sort of piggybacked them all together and did the testing simultaneously, though, instead of doing it in a linear fashion, which takes a lot longer. And that's one of the ways that they were able to develop these much more quickly. But they were thoroughly tested, and pretty much the same numbers of people were tested that they've done with any other vaccine. And the bottom line is that they've been found to be safe and effective. And now we have millions and millions, tens of millions of people who have gotten at least 3 different kinds of vaccines, more than that when you include Asia, some of the Chinese vaccines. And the problems that have turned up have been really less than most vaccines that are accepted as safe and effective. And the effectiveness is amazing. They are amazingly good vaccines with very, very rare side effects. So, I think that's how you approach people's concerns. And then also, I think you mentioned that you're leading by demonstrating it. You've taken the vaccine yourself. Family members have had the vaccine. You've recommended it to your friends. You've recommended it to your coworkers. So you aren't just full of hot air. You're actually, walking the walk and not just talking the talk. So I think that's how you handle it. Questioning people, finding out where they're at, really listening to their answer, providing them with good information in a respectful way, not talking down to them, and then pointing out that you've had the vaccine, and there are really good, solid reasons for getting it.
Yep. And speaking of kind of just trust, Agnes White put a comment in the chat box. The quote was, "I'm not comfortable with the mRNA technology. It hasn't been used in such a big scale as this." So that's another issue to address. How would you?
Yeah, I think when I first read about it, I thought, well, that's interesting. I wasn't aware of other vaccines that used that technology, and it gave me a little bit of pause when they first started talking about it. And so I looked into it, and it turns out, the whole DNA thing was discovered about the time I was born, way back in the early 50s. And, people have been studying DNA, RNA, messenger RNA since then. So for 70 years, and for about 20 years, people have been using the messenger RNA technology to develop a variety of things, especially medications that are formulated to help fight different types of cancer. And there are some other vaccines that have been developed in the last 5 to 10 years that use the same technology. One for Ebola, in fact, has been developed that has been found to be safe and effective. So on the surface of it, I think unless you did this stuff for a living, you wouldn't be aware that there already had been a lot of work with messenger RNA technology for at least 2 decades, and that it has been found to be safe. And that's what I found when I looked into it, that it actually was not as new as I thought it was, and it's been proven to be safe and effective for at least 20 years in vaccines and in other applications, especially in chemotherapy.
Perfect. Another question that Agnes White posed was, I'm healthy and doing all I can to keep it away. Keep that away. If I get COVID, I'll be able to fight it without issues. How do you address that?
Yeah, that's I never get sick, so I don't need it. And I hear this a lot with influenza. And, usually I say, well, that's good. I'm glad that, you have a healthy immune system and that you're a pretty healthy person. And that tells me, that you take care of yourself and you make good decisions about your health. But it's possible that you encounter the virus and you don't get sick because you have a good immune system. But we think that in that situation, you still are, it still is possible that you could harbor the virus and you could spread it to other people who maybe aren't as healthy as you. And if you work in a healthcare setting, especially, you might be able to spread that to somebody who has a lot of risk factors or maybe is immune compromised. And so while you may feel like you personally don't need the vaccine, it may be that if you encountered it, it would help prevent you from spreading it to other people who aren't as lucky as you. So the other thing is that we are seeing now a new trend, and that is an increase in younger, otherwise healthy patients who are coming down with COVID. And even in Billings, I know they're talking about they've had an uptick in hospitalizations for COVID. And, in the first round over the last year, it was mostly patients 65 and older who had immune compromise or had other risk factors. And in this new round, where again, we're seeing an uptick in hospitalizations, it's actually in younger people who appear to be previously quite healthy. So it's good that you feel like you never get sick, but that doesn't make you bulletproof. And so in order to prevent asymptomatic transmission, in order to make sure that you aren't one of those unlucky people who get sick with it, it's a good idea to get the immunization.
Yeah, no, it's a good point, especially with all the variants coming
Right.
now, they say with that. So
Right.
I'll pass it back to Stevie now.
Thank you, Alana and Dr. K, for that good discussion. If you have more questions, feel free to reach out to us. And this is our last session before we break for our sort of summer, while we break for summer. And so when we leave today, our leaving in action is just a real general ask. We've asked that you go out and get vaccinated if you haven't already. Encourage those around you to get vaccinated. Have those good discussions with your peers and your patients to help improve their confidence around these vaccines. And then start preparing for co-administration of adult vaccines this fall. We talked about when we met 2 weeks ago, now you can give the COVID vaccine at the same time as other approved vaccines. And so start putting together those resources. Think about what questions your patient population will have, because they definitely are going to have them. and start pulling together those resources to allow you to navigate that as we approach flu season. We all know flu vaccines start hitting the pharmacy the very last week of July, the first week of August. And so that time will be here before we know it. And it's a great time to sort of educate our staff and give ourselves an opportunity to really think about what we need to support our communities during that time. We want to thank you for joining us, spending a couple weeks with us learning about pneumonia vaccines and the COVID vaccine. Please keep an eye on your emails for future immunization support around influenza, and again, that co-administration of adult immunizations. It's really a best practice to give as many vaccines as you can at each encounter, however is safe for that patient, so that we can really maximize every interaction we have with our patients. So we are going to come back closer to the fall with lots of tools and resources around improving influenza, getting those pneumonia rates up, and then continuing this push on the COVID vaccine front. So thank you all for your work and your time and attention. Feel free to log out, or if you would like, if you have specific things that you would like more information on, when we come back to meet again, please feel free to go back to that Minty Poll and give us your feedback. Thank you so much, everybody, and have a great rest of your day.
Thank you.